My name is Dr. Logan Locke, and today I'm going to be performing two completely different surgeries, an all-on-4 and a 3-on-6. We're going to walk you through the entire process of each one of these surgeries so that you can understand the differences between them. Let's go. One of the top comments that we get is, what is the difference between an all-on-4 procedure and a 3-on-6 procedure? Today, I'm going to be walking you through the entire surgical process for each one of those procedures. We're going to give you a detailed behind-the-scenes view of each procedure, start to finish. So for our two surgeries today, I'm going to be working on these custom-made models. These are the exact same, and they were made based on actual tissue and bone scans from one of our patients. These are her top teeth, and you can see that some of those teeth have already been removed in the model. So the very first thing that we do for this procedure is extract the teeth. We've rigged this up to give you the best view possible so you can follow us along as we go. To get an idea of how much bone reduction you may need, an easy way is smile as big and cheesy as you can in the mirror. With an all-on-4, we have to hide where that prosthetic or where those teeth actually meet up with your gum tissue. We have to hide that above where you can smile the biggest and widest. So in our patient, she could smile and she showed a lot of gum tissue. What that means for her is she'd likely require a lot more bone reduction. So in order to hide that transition between the two, we would likely for her have to remove bone. So step one is going to be removing her remaining teeth. It'd be nice if they all came out this easy. Now that we have all of our teeth out, step two is going to be releasing this gum tissue so that we can get down to the bone. So this is called releasing a flap. We basically pull the gum tissue off of the bone in order to get a nice clean cut of that bone without harming the gum tissue. I'm now going to put that mark back up on the actual bone of where we needed to reduce that bone level to in order to get our all-on-4 on. So now we're going to get in there and we're going to reduce and level off the bone to our predetermined line. Take note, this is one of the key differences between the all-on-4 and the 3-on-6 procedure. So now we've got our bone taken down to the level that we needed it to. It's time to start placing some implants. So the implants for an all-on-4 are going to be placed in the ideal bone positions to maximize the longevity of the implants and the durability of the prosthetic or the teeth that we put in on them. So this is how we drill for implants. We start thin and with each drill we get a little bit wider until we're at the size that was pre-planned for each implant. So this is my final drill for these implants that I have planned. Looking good, we're now ready to get our implants in. There's quite a few implant brands out there that are really good and perfectly adequate for either one of these procedures. Today we will be using TRI implants, which we've been liking a lot lately. So this is a dental implant. For those of you that never seen one, think of it essentially as a screw that is placed into the bone. This is what we use to anchor the teeth to. So this implant will now follow the path that we drilled into the bone previously. Next, we are torquing down the implants and making sure they are nice and tight within the bone. So we're positioning these implants in locations where they will give a lot of support for the teeth that are going to go on top of them. We want some implants further back and then a couple implants further forward to even the load as you are chewing. So again, this is the top arch. So these are her top teeth that have now been removed, bone leveled, and now we have our 4 implants placed in a pretty common pattern for what we normally see in a patient receiving an All-on-4. So this is a very common position for an All-on-4 for these implants. You can see the ones closer up front are more straight up and down. The ones in the back are generally have to be angled to avoid the sinus cavity that usually lies about right here in a patient. So our process for getting the patient teeth starts now. Basically, the teeth have already been pre-designed, but our lab doesn't know where these implants are positioned. We now are going to take some very precise digital scans that allow the lab to take that design and really mold it to where the implants actually are in this patient. So now we have some different parts attached to our implants. We're going to tie our gum tissue down and take another scan so that the lab can then know exactly where to position those teeth. We've got the gum tissue all tied down. When we do an All-on-4 and we have to do bone removal, we usually have an excess of gum tissue. Sometimes that's trimmed away, sometimes it's tucked down. I've kind of tucked it down in here now so that the teeth, when we make them, will rest right on top. So we already did the scan to tell the lab where the implants are. This is a scan to tell the lab where the gum tissue is. In our office, this is a completely digital process, meaning we never put any impression material in our patients' mouths. It's all just done from beginning to end with digital cameras like this one. Okay, so we now have our All-on-4 3D printed and ready to go onto our patient. A couple quick notes you can see for these. The reason we take that down or remove and reduce bone is both to hide this transition where that fake gum tissue will soon meet the real gum tissue. The other reason is because this is one piece, we need it to be nice and strong. So we need the thickness because it's all one piece throughout the entire process. Another thing to note, because we've done this completely digital, you can see how small these holes are where the screws will enter into. There are other ways to do this without all those digital tools, but the result is going to be much thicker, much less comfortable for the patient. So having the photogrammetry, having these digital scanners, it's all very expensive for an office to invest in, but it makes the outcome for the patient much, much better. And here we have our final result. This is a lot more like what you would see on a patient instead of a model, where the gum tissue is nice and tight up against the fake gum tissue. With this model, we have a little bit of a space right there. That's just because of this tissue is not quite as realistic as what a normal person would have. But that's about the result that you can expect if you are having an All-on-4 done. Show you the inside of that. That's about an average thickness of an All-on-4. Sometimes, depending on where the implants are placed, you can occasionally get a little thinner, a little bit thicker, but on average, it's gonna be about like this. With our patient, you can see here the teeth meeting the natural gum tissue, which would be down here. The reason for that bone reduction initially is so that when you smile big, you can't see this connection right there. But if you pull your lip back, this is what you would then see. We can obviously make these really, really nice. This is a temporary, so it is temporary material. We'll use this for the next 3 months for our patients. And after that, we give them a zirconia final, which is a really strong ceramic that allows it to look a lot more natural and be a lot stronger. But this is our piece that we heal in for those first 3 months after our surgery. So now that we've finished the process for an All-on-4, and you've seen that start to finish, now we're gonna jump into our exact same patient, but this time we're gonna be performing a 3-on-6 surgery on this one. So the very first key difference with 3-on-6 versus the All-on-4 that we just did is the implant placement. For a 3-on-6, the implant positioning has to be perfectly accurate to where we have it planned in order for the teeth to be as small and as lifelike as possible. In order to achieve that, we have to use something to guide where those implants go, which is this 3D printed implant guide that we have here. So this guide is going to rest on these remaining teeth, which is going to make it really, really solid. This is exactly how it would be on a live patient. We're then going to drill through these cylinders here. So these are all based on scans that we took before the patient was asleep, and all the implants were planned before we even started the surgery. So this guide now will help us take that plan and make it exactly that way in the patient's mouth. You'll notice at this point, we didn't have to release that flap like we did with the All-on-4, and we haven't reduced any bone at all. Now we're using this guide, and it is going to, again, position that drill exactly where it needs to go to get the implants in the perfect position. So same thing, we're gonna start small and we're gonna work our way up. So right now we have our holes drilled within the bone. That was done through the guide, so they're all in very precise positions. We're now going to place those implants through the guide again so that the implants end up in the perfect position for the teeth.
We're still fairly atraumatic. You haven't pulled back the tissue at all yet. You still have teeth to remove, but all the implants are in and in ideal spots to have a really thin, nice looking prosthetic. So we're going to do the same scanning process that we did for All-on-4. We're going to do now on our 3-on-6 patient, and then we'll get to making the teeth.
So now that our implants are in for this 3-on-6 case, we're going to remove the rest of the teeth and kind of prepare everything to seat the teeth on. In this case, we're gonna try and do this without having to take the tissue back too much. With this model, I might have to just to be able to get things formed like it would be on an actual patient. But generally speaking, we can keep this very, very conservative, which is better for the healing process. Less pain, less bruising, all of that becomes a lot easier the more minimally invasive we get. Teeth are out. I'll still have to take them down a little bit just because they obviously would generally have the roots with them. So we're gonna shape things just a little bit here so that the teeth fit on nice and pretty. In an actual patient, we wouldn't have to really do much there. The teeth should fit on nice and snug, right into kind of the positions where the teeth were previously. Unless we're making a lot of changes, we try and keep everything about right where it was when you had your natural teeth. So after we're done scanning, we send those scans to our 3-on-6 lab, and they are going to then do what's called a conversion, where basically they take our pre-design and they mold it so that it fits the patient and where the implants were actually placed. Then we 3D print it while the patient's still asleep. We cure it, we do everything here, prepare it, and then it goes straight into the patient's mouth. So this kind of technology has made it possible for us to give a very sleek, a very lifelike restoration. While the patient's asleep, they wake up, they've got a beautiful set of teeth in, ready to go. After the scans are sent in to our 3-on-6 lab, they will do that conversion where they match it to form the actual patient. We 3D print it, and then this just barely finished curing. So you'll be able to see what the teeth actually look like. We're gonna pretty them up a little bit now and make them a little bit shinier, a little bit more lifelike. and then they'll be ready to place into the patient's mouth. So now we're going to screw in our 3-on-6 temporaries, see what they look like. With the 3-on-6 procedure, we can often be very, very conservative. In this case, we didn't have to pull back that flap at all, so the gum tissue still remains incredibly tight and attached to the bone, which is very, very good. Only on this side did I have a little bit come loose, so I tied a couple stitches over here, but this would be a very, very conservative, very nice looking surgery for someone. We'll now take this off and we'll compare the two and show you what they look like next to each other. All right, guys, this is a lot. We're halfway through the video. If this type of video is helpful, if you like this type of content, please like the video so we know what we should make more of. Throughout this video, we are working on models, and sometimes it's hard to picture what the final results actually look like when we're looking at plastic models. If you want to see real results on real human beings that have been through these procedures, visit my Instagram. The link will be in the description. And lastly, another great place to get more information and to speak to actual doctors that are performing these surgeries or patients that have been through the surgery is our Facebook group. There's a ton of knowledge there. Link is in the description. All right, that's it. Back to surgery. Keep in mind, we did this surgery on the exact same model. We just chose two different pathways that are both adequate, but to help you understand which one might be right for you, or to help you understand the differences between the two. We're gonna zoom in on these teeth to get an idea of what your prosthetic or what your teeth are going to look like. This is a pretty standard all-on-4 prosthetic compared to a pretty standard 3-on-6 prosthetic. You'll notice initially this is also one piece. Once the patient heals after 3 months, this will be separated into 3 separate bridges. This will remain as one piece even in the final prosthetic. Biggest differences are in shape and size. You can see how much thinner we can get with a 3-on-6. The reason we're able to get this thin is because of that guided implant placement that puts those screws right in the spots where we want them to give this thin, really natural result. The All-on-4, on the other hand, is a much more forgiving prosthetic. These screw holes ideally are about right in this location, but they can come out because of the thickness in different areas a little bit easier. Besides the all-around size, probably the most obvious difference is the fake gum tissue line. With the 3-on-6, we have no fake gum tissue line. We're gonna use their natural gums to fill in and try and recreate what the natural teeth once looked like in relation to the gum tissue. With the All-on-4, we reduce bone enough that we can create this fake gum tissue line. It gives a really nice aesthetic result, but we have to hide that so that you can't see that transition or the connection between the fake gum tissue and the actual gum tissue. Okay, so with a 3-on-6, your temporary that you heal in for 3 months is all one piece. After you come back, we will then segment into your final porcelain teeth. This makes the restoration a lot stronger. It also helps support the bone that is around the implants. By segmenting the prosthetic into smaller bridges, we are going to achieve a much stronger prosthetic. It is going to be much less likely to fracture over the lifespan of your teeth. So now that you've seen the process for both of these procedures, let's take a dive into what's going on here. The All-on-4 has been around for a long, long time. There are many people across the country that can do this procedure well. The 3-on-6, meanwhile, has been around for a lot less time. It takes more training. and oftentimes a lot more skill to perform. The surgery for an all-on-4 can be as quick as 2 to 3 hours. The surgery for a 3-on-6 is going to be, can be up to double that. The all-on-4 requires bone removal and a fake gum tissue line. The 3-on-6 requires no bone removal most of the time, and we use the natural gum line. We try to recreate what that looked like with natural teeth. The All-on-4 prosthetic is going to be a little bit thicker, a little bit more unnatural feeling, but generally speaking, patients get used to it fairly quickly. The 3-on-6, meanwhile, is going to be more sleek and a lot more similar to what your natural teeth felt like and looked like. One of the questions we get all the time, and that is, what is the price of an all-on-4? What is the price of a 3-on-6? The hard answer to that question is that it varies greatly depending on where you are in the country and the provider, how much experience they have, and your specific situation. The best thing to do is make a quick call to a 3-on-6 provider by you. Make a call into us and we can look at your situation specifically and give you a really accurate quote for what it's going to cost you to get into either one of these. Most of our 3-on-6 providers also offer all-on-4. So if you want a quote for either one of these procedures, give one of us a call. You can find 3-on-6 providers across the country at 3on6.com. Hey guys, we hope you have enjoyed this video. We hope it's been informative, that you've learned a lot from it, and hopefully it's answered some of the questions that you may have. If you have made it this far in the video, you're likely looking at something like this. This is a stressful time for you. I know it's a hard decision to make. It's expensive, it's stressful, no one likes to go through with it, but I promise it will be worth it in the end. Some of you guys have family or friends that are going through a situation where this may be required. Send this video to them so they can make an informed decision, so they can know what they're getting into. That's what we want. We don't want to push either procedure on anyone. We just want people to understand the differences between the two and make a decision that is right for them. Drop us a comment if you have any other questions you need us to answer, or if you want a consult, feel free to reach out to us or any of our 3-on-6 providers across the country.